How can I, let me see if I can open my own computer here. So let me first start by sharing a little bit about the organization that I have the great pleasure to represent. That's the National Hispanic Council on Aging. And I can't see from behind here, but so I'm going to follow my lead here on my own laptop. So the National Hispanic Council on Aging is based in Washington, D.C. We've been around for about 40 years, and we have a very straightforward mission. Our mission is to improve the quality of life of older adults, their families, and their caregivers. And we focus our efforts in key areas: health, economic security, housing, and leadership development. And caregiving actually cuts across different areas of our priorities, but often with sort of the realm of health. So, so let's dive right into caregiving. In the last several years, we have identified caregiving as a key priority for our community, for our society, and for our country. In partnership with other organizations that I think it's important to acknowledge and recognize, because they're playing an important role in moving forward this whole issue of caregiving. We have been able to make progress. So agencies like AARP, for example, and I know many of you work with your AARP local chapter here, the Alzheimer's Association, the National Council on Aging, American Society on Aging, Grantmakers in Aging, Gerontological Association, and other organizations in the field of aging are making caregiving a priority. In addition, there is a coalition that has been created in the last 5 years, the Diverse Elders Coalition. And the Diverse Elders Coalition has also made caregiving a priority, and we are one of the founders of that coalition. And so we are working aggressively on caregiving as it relates to healthcare providers and as it relates to policy. So it's an exciting moment to be in the caregiving space and to be here with you, to engage you and to ask for your help in this whole caregiving effort that we all need to take and play a role in order to continue to make a difference for our families and our communities. So first, who are caregivers? Caregivers provide minimum amount of care to a family member or friend to help with activities of daily living. Now, especially for older adults, it is often overlooked, and it is a major challenge facing our country. So caregiving is often overlooked in our society. It affects millions of families every day in all walks of life. And communities of color, Blacks, Latinos, Asian and Pacific Islanders, American Indian and Alaskan Native communities, and LGBT communities are particularly challenged due to inadequate availability of culturally and linguistically competent support for family caregivers. So let's reflect a little bit on sort of where we are with caregiving. In 2014, we had about 34 million individuals in the United States who provided unpaid care to someone aged 50 years or older who needed help as a result of limitations in physical, mental, or cognitive functioning. The largest segment of caregivers are relatives, so what we consider family caregivers. However, the term family caregiver also includes any partner, close friend, or neighbor, related or not. And we know that by 2030, 72 million people, 1 in 5 people in the US, will be 65 years old or older. So as our colleague earlier indicated, this older adult population is increasing very quickly, and this is happening across the country, not just in Florida, but across the country. And we also know that the largest increase will be in the oldest old persons. In other words, those who are 80 years old and older, and who will have the greatest need due to their physical, cognitive, and functional limitations. The other element which was mentioned earlier during the introduction is that the older population will also be more diverse. And that means we need to equip ourselves with ways and strategies that will address and will respond to the diversity that we are being presented with. By 2030, 3 in 10 older Americans will self-identify as a minority. Now, the LGBT population will also increase. It will more than double its current population. So the demand for caregiving is increasing. It is projected that it will continue to increase as a result of this aging of our demographic and this shift in our demographic. We also know that the size of American families is shrinking, and the makeup of families is changing as greater number of older adults are not having kids, were never married, or are divorced, or are in blended families. So those are interesting dynamics and new realities that we have to deal with. Extended families are geographically dispersed than previous generations. So it is not uncommon to see that grandma or mom is in Puerto Rico and the caregiver is here in Florida, in Orlando, as a result of the hurricane over a year ago. And those shifts took place, and the diaspora from Puerto Rico came to the mainland. So those realities are increasing in number. And the growing diversity of older Americans will also further increase the demand for caregivers. And specifically on that, we know that African Americans, Latinos, come to the face of an older adult when the time comes when a Latino or an African American person becomes 65 or older. They usually present themselves with multiple chronic diseases, a history of lack of preventive services and preventive practices that will keep them healthy. So oftentimes these our communities have had jobs in the construction industry, for example, where they've had to be involved in a physically demanding job, which means that by the time they are 60 or 65, they may have complications resulting from injuries. And so all those realities are going to demand more caregiving as a result of an aging in certain communities. Now, an interesting report was developed a couple of years ago, now 3 years ago. And it was the National Academy of Sciences that put together brought together a group of experts to understand and figure out what the nation should do around caregiving. And so it was an important and seminal piece of work that has been done. I think it's a framework for many of us to move forward in the area of caregiving. It is actually a roadmap for our work, for the work of other organizations that are working in partnership with us. And essentially, the report is lengthy, and I invite you to read it when you get a chance. But it essentially made two important recommendations that I'd like to highlight here today. One is that it urges to strengthen the training and capacity of healthcare and social service providers to recognize and to engage family caregivers and to provide them evidence-based support and referrals to services in their community. The other important recommendation is that the National Academy of Science encourages education and training to help professionals better understand the cultural differences among the family caregivers they serve. And so I think today, I applaud you for coming together to listen to this issue, because we're here today doing exactly what the Academy of Science has requested of us to do. I think many of you are healthcare providers. Many of you in this room are healthcare providers. So let's go a little deeper and look at the case of Hispanic caregivers. So we've done some work, some deep analysis and research to have a better understanding as to what the gaps are, what the realities are for Latino caregivers. And here's what we're seeing. Latinos often do caregiving without realizing it or even calling it caregiving. So, in other words, it is common for a Latina to be involved in caregiving activities, but not self-identify as a caregiver. And what happens is, because he or she doesn't think of herself as a caregiver, she doesn't look for help. She doesn't ask for help. She doesn't look for resources because she thinks that as a daughter or as a son, it's her responsibility to do it. And it's great. I think that's a protective factor for the Latino community and for many other diverse populations where this cultural element is prevalent. And we need to support that and encourage that and foster that. But we need to support that with resources and information. So it is, and we also see that Latino caregivers often embrace their role and view themselves as caregivers, and they see it as an opportunity to give back to their loved ones, to those who have helped us and who have come before us. So we see it as an honor, and that's great. We want to continue to work on that, and we want to continue to ensure that our community keeps that as a protective factor. And I ask you to help us ensure that that stays with us, because that will help all of us. So again, caring for an older adult in the Latino community is an honor and a role we perform willingly. We have been taught the importance of respecting our elders and honoring their wisdom and being there for them in their times of need. And according to the Family and Caregivers Alliance, the Hispanic caregivers have the highest reported prevalence of caregiving, with 21%. African Americans have a 20%. Asian Americans have a 19%. And whites have a 16%. So with the high rate of caregiving among Hispanics and among African Americans, these communities often struggle to find information and support they need to assist them in their caregiving roles. The lack of information and support contributes to elevated levels of stress and poor health. So NACOA and its partners want to understand and address the needs of caregivers and develop programs and interventions that offer the education and training necessary to construct a network of caregivers who are well equipped and informed across the country. So if we can move up to the next one. So we're in looking at caregiving as a priority. The National Hispanic Council on Aging has, over the past couple of years, implemented a national caregiving survey. So we have carried out the survey with approximately 600 participants so far. The survey continues to be applied in different parts of the country, including Puerto Rico. It is being done in English and Spanish. And the goal of this survey is to understand the demographics of Latino caregivers. We want to describe the challenges caregivers face, and we want to recognize what resources are needed to support caregivers in their roles. And here are some preliminary data that we're finding from these surveys. So the average age of caregivers in this space, in the Latino space, is 54. 81% are women, so the greatest majority are women. 17% are men. 53% are married. 55% have a bachelor's degree or higher. More than half are holding a job in addition to being a caregiver. And a little over 50% have an annual income greater than $30,000. 73% speak English well, and 78% read English well. So this is to give you a taste of what we are beginning to see in terms of what the caregivers in this Latino space are reflecting in terms of demographics. When we ask what their top 3 challenges experienced as a caregiver, they're telling us that most caregivers report that having the money to afford caregiving was among their top 3 challenges as caregivers. They're also saying that not understanding programs such as Medicare, Medicaid, SSI, SNAP was a major challenge in their caregiving roles. And I think it's important here to mention that the elections are coming up in November, and that many of these programs that are critically important for all older adults to age in dignity are at stake. Social Security, Medicare, and Medicaid. And I think it's important that our caregivers, as well as our older adults, understand that whoever will represent them will be protecting those programs. The other challenge that they reported to us is that balancing family and personal responsibilities is a major challenge. In addition, the caregivers have reported to us the need for more training on stress management and help understanding and navigating government programs. Another major concern among Latino caregivers is that many are untrained, and nearly half of caregivers requested training on caregiving techniques in Spanish. I should share with you that we are working to establish a caregiving university in the coming few months to be able to begin to equip this network of caregivers across the country with those basic elements they've indicated are needed. So I think it's important to put a face to this issue, and to hear directly from someone who has done caregiving for a loved one. And so I've invited Margarita Navas, who has cared for her mom, who was living with dementia, Alzheimer's, for about 10 years. And I think she is an example of what many caregivers go through. Margarita is an English teacher. She speaks English well. She understands the system. And yet, the obstacles that she had to overcome and the struggles she had to overcome during her time as a caregiver for her mom were huge. And it just reminds me of what caregivers who don't have the resources and information that Margarita has need to go through. So if you can join me, Margarita.
Good evening. As Dr. Cruz said, my name is Margarita Navas, and I live in this country for like more than 25 years. I'm a teacher. I teach English as a second language. I used to teach for DC public schools in Washington, DC, elementary schools, and now I teach adults. So I'm going to explain a little bit about my mother. She was she was a lady who came very independent. She had her own business back home. I'm from El Salvador. Very secure and creative. And she moved here because besides being independent and creative, but also she was always afraid, nervous, and during that time we had a war back home. So she decided to move here by herself. All my brothers and myself, we were living back then in El Salvador. So she came here with goals and the hope to, one day we moved to this country, my brothers and I. And like I said, she was an entrepreneur. She had her business back home and very successful. So her goals were those, open her own business here in the United States. She learned English enough to survive, she was not fluent in English. When I came, but besides that, I'm the only girl, so she was very protective. So when I moved to this country and to the US, she became very protective of me, but I thought it's normal. But throughout the years, I got married. She became more and more. My older brother came to visit us one time, and he noticed that. And we took it like, Mom is just too overprotective with you, and she worries about you. My older brother was very educated, and we didn't have any idea. We didn't know the symptoms of Alzheimer's. We didn't recognize any of those, like schizophrenia or afraid of everything, that it was part of her illness. We didn't have any, we never thought about that. Until everything started becoming worse, I took her to a geriatric, one of the best in Washington, D.C., and just to talk and tell him, her symptoms, he said she has Alzheimer's. As a loved one, and I didn't want to accept that, and I said, can you do more tests? Unfortunately, the tests in that area in Washington, they are in English only. And she was not fluent enough. I said, I can translate, but I knew that it was not going to be possible. And he said, no, it has to be in the native language. There were some tests in Spanish, I think in Texas, but they were not finalized. They were in the process of trying to. So I had to accept that my mother had Alzheimer's. And so by learning that the tests were not in native language, in Spanish, that was the first point of reality of what I was going to go through. But in order to help her, I decided to educate myself on the illness. I've heard before about Alzheimer's, but I didn't know anything else. Just the name, and that's it. So I started learning and reading books. But it was a point that I couldn't continue reading because I didn't want to accept my mom was going to get to that point. So I took her back. She was living by herself during that time. And she came home with me. And my daughter was in first grade, and my son was in second grade. I was teaching English to adults. I was trying to juggle being a housewife, mother, teacher, and a daughter, taking care of my mom. It was very difficult. I had to manage time with time, and I seek for help. I called some offices, sometimes never answer, only press this number, press that number. So I gave, or then finally, the line went off, dead. So every day I tried, and people gave me phone numbers, called this place, and I tried. One time, my mom was taking a nap, and she got up from her nap. Only my mother and I were home, and she fell down and broke her pelvis, I think. So the doctor said she had to go to a nurse, she had to have therapy, physical therapy, so she went to a nursing home to receive some, but she never got it because every week she had something. She was anemic, so rushed to the hospital. So every week she had to be rushed to the hospital for something. She stayed for 3 weeks, and I decided to bring her home. My mom didn't get up. I'm sorry. She was in bed for 10 years. She never got up. She, not even in a wheelchair. So I had to take care of her. I had to move her every 4 hours from one side to the other so she didn't get blisters. I had everything, she had to eat everything puree, nothing because she was in bed. But I remember the day when she came from the hospital and the doctor gave me, everything, she had to eat everything, puree and things like that. They brought her hospital bed. I was by myself. And I remember when she came, the ambulance brought her. And then I said, and then what? When everybody left and I was by myself with my mother, I said, what do I do? I didn't know what to do. I didn't even know how to change her sheets, las sábanas. So how do I change them? My husband, he works in a hospital. He's the one who taught me how to change them because I didn't know. So when the kids came home, they had to go to soccer practice, to Girl Scouts, all the extracurricular activities that our children take sometimes. I have help from, relatives to take my kids to those extracurricular activities because I had to be at home with my mom. A nurse came every 2 weeks. Someone came once a week to, feed her or change her or bathe her. But after that, it was just me. So when I started trying to call and I gave up, I said, I need to continue with my life. I need to continue how to take care of her, how to take care of my kids, how to teach my students. So I started teaching from 7:30 in the morning to 9 o'clock or 11, and then I knew that time my mom was sleeping, or I left her, prepare and came back, spent the day teaching on Sundays, and that was my routine. And it's easy to get caught in that routine. And I know that we need to ask for help, and we need to look for help. I tried, but I encourage everyone to continue looking for help because it's difficult to do it by yourself. My brothers were back home. They gave me support morally because when I felt sad or I need advice, I called them. But they were not physically here. I was the only, and like Dr. Cruz said, I am the only daughter. I am the one, the girl. So I am the one who needs to take care of her, and that's what I did. But I encourage everyone to look for help, to investigate, to try to, because it's easy to, years pass. I just realized that when my mom passed away in 2013, my daughter was almost, my son was about to graduate from high school. So, and I tried to do the best I could, but sometimes, it cannot be done alone. So we had to look for help, and at the end, I became my mother's mother. Thank you.
Thank you, Margarita, for sharing your story. And if we can go to the next slide. I think Margarita's story epitomizes the reality in our communities, in many of our families. And as indicated earlier, the Margaritas of the world will continue to be there in greater numbers because Alzheimer's is on the rise, because populations are getting older. And if the needs of caregivers are not addressed, we risk compromising the well-being not only of our elders, but those who are caring for our older adults and their families. So I think, and just to build on the work that has been done by the Academies of Science around caregiving, I think the Academies of Science reminds us, but Margarita's story also exemplifies the personal impact of family caregiving. The intensity and the duration of caregiving and the older adult's level of impairment are consistent predictors of negative health effects for the caregiver. There's also systemic barriers that we need to consider as we look to address caregiving in our communities and in our hospitals. Some providers exclude caregivers from older adults' treatment decisions and care planning, while also assuming they are able, have the knowledge, and are willing to perform essential tasks. Tasks that oftentimes are fairly sophisticated for someone who is a layperson who does not have training in the clinical setting. There are also effective interventions. Education and skills training can improve caregiver confidence and ability to manage daily care challenges, so that we know there's a solution. We just need to get proactive and be thoughtful about this. Finally, I know we're running out of time, but I wanted to just share briefly, very fast, some of the findings we have heard from roundtables we've held on caregiving in different major areas of the country. We've held a thought leaders roundtable in DC, and we brought together around 40 experts, and here are some of the recommendations they're making. They're thinking that it's important to create a caregiving hub for different organizations to feed information and spread awareness on services available for family caregivers. They think it's important to frame caregiving as a multi-generational issue that affects all communities and not just older adults. They also think that it's important to partner with organizations that specialize in their community with specific diverse populations to develop programs and services that meet the needs of specific populations. And I think these ideas are important for you to know, so that as you develop your programming and your efforts, you can keep this in mind. We also brought together a group of 35 experts on family caregiving in New York City. And here's what they're thinking. They think it's important to identify resources that are linguistically and culturally appropriate for Hispanic caregivers. Second, informing and educating employers on how to provide support for those employees that are caregivers. Third, creating campaigns demanding decent wages and salaries for caregivers. Fourth, providing health plans specific to caregivers' needs and advocating for funding to create programming and education for caregivers. And we also met in New Mexico, in Albuquerque. And what Albuquerque indicated is educating and understanding who a caregiver is. And they think that's an important effort to be undertaken in New Mexico. Identifying and understanding the value of a caregiver, so recognizing the caregiver. And they also acknowledge this whole issue of paid versus unpaid caregiving and how this whole thing fits into the equation. So those are some of the findings that I wanted to share with you with regards to those three cities. We will continue to do more roundtables, and we will be in Philadelphia in the next few weeks, as well as in Texas before the year is over. And we're very interested in coming to your region here in Orlando particularly after listening to some of the leadership that got together this afternoon. And I was reminded of the growing diversity in this region, as well as the increase in the older adult population. So I hope to continue to work with your leadership here at the hospital to see if we can make that possible for next year. So I will stop there and turn it over to our facilitator.
And so now I'm going to ask to the stage Dr. Lugo, who's going to help with the roundtable or with the just question and answer. Thank you.
Okay, I'm just going to walk upstairs.